still do so, but we must do so safely to prevent the spread of this disease. You may enjoy a daily walk in the park with others in your household, but please maintain a safe distance from those that are also enjoying the public spaces, and do not touch any of the equipment where the virus may be lurking. The intent of this directive is to help, not to punish. While this directive does come with consequences for those who fail to comply, law enforcement has to give warnings before moving to more drastic measures such as civil or criminal penalties. My goal throughout this whole crisis has been to provide for the health and safety of Nevadans, and I have partnered with Attorney General Aaron Ford, who is working with local law enforcement agencies across the state to ensure they understand the intent of this directive and how to implement appropriately. As your governor, I understand that every choice I make has real-life consequences for the citizens of the state, for each and every one of you. That is not lost on me. I wake up every morning thinking about the impacts of my decisions. But here's what I know. Whenever I'm faced with a tough choice, there are a lot of factors that I must consider, but none are more important than public health. Before making my final decision, I ask myself, will making this choice save lives and help protect our healthcare system? When it came to this measure, the answer was yes. I know this is all moving very fast, but I assure you, as I continue to make decisions, I will remain focused on one singular question. Will this action prevent more Nevadans from dying from this virus? That's the goal. By uniting together and fighting back against our invisible enemy, the more Nevadans will protect, and the sooner we'll be able to be open for business and get back to work. Before I take some questions, I want to update Nevadans on other work we have been doing in my office to protect the public. Today, we issued guidance to ensure child care is prioritized for first responders and healthcare workers, so they continue to be on the front lines of fighting during this COVID-19 crisis. I also signed an emergency regulation promulgated by the Board of Pharmacy to limit the hoarding of two certain drugs, chloroquine and hydroxychloroquine. While the two drugs serve necessary medical purposes, there is no conclusive evidence at this time among COVID-19 experts or Nevada's own medical health advisory team that the drugs provide treatment for COVID-19 patients. The emergency regulation is aimed at preventing the hoarding of the drugs so those who actually need them can have access to them. In the continued effort to be honest with Nevadans and share the information I have, I will soon be providing Nevadans with daily updates and situation reports. Thank you. I will now take some questions.
Governor, you've had a lot of questions about testing, including the following question from Sherry Swank, who asked, can you clarify how testing is being conducted?
I can qualify it in this way, and I can answer it in this way. Nevada has submitted 4 requests for COVID-19 testing components. We have received 0 shipments of COVID-19 testing equipment, supply components. Nevada has 4 pending requests for COVID-19 testing kits. We need testing kits desperately. I applaud our federal delegation for working so closely with me to make their requests known in Washington, D.C. on Capitol Hill, and the Vice President's Coronavirus Task Force, and to everybody that'll listen to them, and they will continue to assist me in providing kits for our medical center.
The next question, Governor, is about PPE, or personal protective equipment. There have been multiple questions, but this one is from Colton Lockhead at the Las Vegas Review-Journal. He would like to know, where are we when it comes to getting more ventilators, masks, PPE, and other medical supplies for Nevada?
Nevada has placed 2 large orders for PPEs. The first order we placed, we got 25% of the order delivered. The second order we placed, is pending. We expect to receive 25% of that order. That's what we have received to date. Our communities, the outreach has been incredible. Just today I was notified that Chinese Asian American community has donated thousands of masks to various hospitals and providers in our community, and I thank them for that. And I ask you, if you're a business out there that has N95 masks or any of the material that we're looking for, call my office. We desperately need the PPEs for our patients and our medical providers that are on the front end. We're asking our providers to risk their life on a daily basis. We need to do everything we can. It's incumbent upon us to provide them with the tools necessary.
We've also had multiple questions about the ongoing construction projects, including the following question from Jackie Kostek at KTNV, who wants to know, why is all construction deemed essential? A worker tested positive at the Resorts World site. Should the whole site be shut down for 2 weeks because of that?
I am aware of that test. I was made aware of that result in the last 24 hours. My office is reviewing this issue, and we will come back with an update as soon as I have one. I don't have an answer to that question as I stand here today.
The next question is from Michelle Price at the Associated Press, who wants to know, has the governor asked the Department of Defense about setting up a military field hospital in Nevada?
We have spoken with the Army Corps of Engineers on a regular basis. We've spoken with our Brigadier General. We've spoken with the Vice President's office as it relates to this. We're analyzing the various situations that might be available, the buildings that might be able to accommodate such a request, and we'll come back with a plan in the future.
We've also had a few questions about the mission of the new private sector task force. Austin Carter from KTNV asks, how will this task force identify needs and deploy them?
Well, I think the first need that they've identified came in an earlier question about PPEs. We are desperately short of PPEs. I know that I was told that the group that provided the masks delivered 300 masks to one of our local hospitals, and the doctor was virtually in tears as a result of receiving them. Mr. Murrin and the people that he is working with have access to people I don't have access to. He has access to contacts around the world that can help provide us with some of this material, and I appreciate his generosity in giving of his time to help us to obtain some of these things that are necessary. We're not getting what we need on the federal front, and it's through no fault of our federal delegation because they're working hand in glove with my office to do everything they can to get it there. But we need to provide for ourselves, and that's what we're doing.
The next question comes from Matthew Seaman with KSNV News 3, who wanted to check in with some questions regarding mortgage and rent payments in Nevada during the outbreak. He asked, what is the extent of your authority when it comes to rent and mortgage payments? Is the state of Nevada able to provide any relief? And have you been in contact with any businesses or agencies that could provide assistance?
My response to that is I'm working immediately with the Attorney General's office. We have been working with the Attorney General's office to address this issue. He is researching the options that we have available to us, and we'll come back with an answer to that when we have enough information to provide a succinct answer and can answer your question.
The next question comes from Megan Messerly of the Nevada Independent. She would like to know if you think the Secretary of State made the right decision to hold the primary election entirely by mail.
Secretary Sagaski called me when she made that decision. She's an elected official. I have the utmost respect for her and the job that she does. She did consult with the registrar and the clerks in all of the 17 counties as it relates to this decision. And this is something that she informed me that they came to unanimous consent that they wanted to move forward with. So I will respect her decision as it relates to that.
The next question is from Jacqueline Schultz of Fox 5. She says plenty of people have called Fox 5 saying the unemployment website keeps crashing, the phone lines are crashing, and they have not been able to file unemployment for more than a week. She'd like to know what is being done to help Nevadans in urgent need.
Well, I can tell you that Dieter, where these claims are handled, are doing an incredible job. They're working 24/7. There are anecdotal situations where people are having trouble with filing a claim, but I can tell you from the enormous number of claims that we're getting, the vast majority of people are getting through. I advise them to file it on the internet. It's a lot easier to be done that way. Getting through on the phone line is difficult. It ties up one individual for an extended period of time, but I advise them to keep on trying, and their benefits will not be affected as a result of the delay.
The next question is from Max Darrow of KSNV, who asked why cannabis dispensaries are considered essential and did not have to close.
The citizens, the voters of the state of Nevada voted to make cannabis legal. First it was medical cannabis, then it was recreational cannabis. I was in local government, and before I get to the final answer, I want to give a shout out to my local government partners. I mean, mayors and commissioners and city council people across the state have gone above and beyond to try to help us get through this situation and to help us enforce these directives that we put forward. And I thank them for that, and I ask them to continue to help us. But when I was on the county commission, we were well aware of the fact that the policy was in place to have it medical first, and then, like I said, recreational. When recreational became available, a lot of folks decided to lapse their medical card for various reasons, whatever that might be. It affected some things, and they were buying it on the retail market. I do not want to disenfranchise the people who previously had a medical card and then let it lapse. So they're buying it recreationally, but it's on a delivery basis only.
The next question is from Noah Glick of Mountain West News Bureau. He says, mining has been determined to be essential during this time. Can you explain why mines are allowed to operate while other industries like gaming are not? Do you consider gold, copper, lithium, or other materials to be essential in times of emergency?
I do not claim to be an expert on mining. We are consulting with the professionals, the experts as it comes to that, the same as we do with construction, and we'll come back to you when I have more information and a better answer as it relates to that industry.
The next question is from John Sadler at the Las Vegas Sun. He would like to know how this order will affect lines around grocery stores.
Well, you know, we ask the grocery stores and the pharmacies and all the convenience stores, any business that's currently open, to please practice social distancing. I want to thank the grocery stores that opened up early to give seniors a chance and our vulnerable population a chance to get in. I've had anecdotal stories where a lot of people have called me and texted and said they appreciate it. That's the only way they were able to get into the grocery stores. I asked the grocery stores to please make sure that your patrons are practicing social distancing when they're in the stores. But while I give that out, when we're talking about grocery stores, I want to give a shout out to the grocery store clerks, to the people that are stocking those shelves, to everybody, to the truck drivers that are keeping the supply chain open to the grocery stores, because without them it couldn't happen. And I also want to make another request of my county and city partners. I grew up and kind of cut my teeth on local government, and I know when I was on the county commission, we put a restriction on delivery for a lot of our stores, grocery stores and pharmacies and whatnot. And oftentimes it was from 8 to 4 or 8 to 6, depending, because the neighbors didn't want the trucks coming, having the beep, beep, beep coming when they went there. And we put restrictions as a result of that. And I would ask those local jurisdictions to please look at putting a moratorium or lifting those restrictions, at least on a temporary basis while we get through this, because when we get a truck to a store, I need it unloaded as quickly as possible so we can get that truck back on the road and continuing the supply chain. So I'd ask my partners in local government to please look at addressing that situation and help us out.
And this will be the last question for today, but I'd like the members of the media to know that if we haven't gotten to your question, we will be doing regular briefings going forward, and we will continue to compile your questions for Governor Sisolak. So the final question today comes from Anthony Avellaneda from El Tiempo. He'd like to know, today President Trump said he hopes to reactivate the economy before Easter. Would Nevada be prepared to do that?
Let me start with this. I'm not a doctor. I am basing the decisions that I make on a daily basis, and I can tell you these are not easy decisions. You can ask my wife. I have a lot of sleepless nights as it relates to these decisions. Any decision that we make about ending this, shutting it down, de-escalating, will be made in consultation with medical professionals who are basing these decisions on facts and statistics, not on emotion or political gain. I want to thank everybody for joining us again. I hope I've been able to answer some questions. I want to thank everybody that's helped us by staying home for Nevada, that's taken this seriously. It's encouraging when I see the outreach in the community to their neighbors, to their friends, and on a regular basis, supporting their friends, supporting our community. And those who have not understood the severity of the disease, I ask you to please listen to me. We have doctors and nurses around the world that are dying as a result of providing service, and this disease can only spread. This virus can only spread if we help it to spread. If we practice social discipline, distancing, if we practice it diligently, we can prevent this virus from spreading. But that's incumbent upon each and every one of us. It's not about you. It's about your parents, your grandparents, your grandkids. It's about their lives. Please join me in taking this seriously and in staying home for Nevada. Thank you.